Welcome back. It's 29 minutes after 2 o'clock. You're watching the Midday View on ENCA DSTV channel 403. Thank you very much for joining us. Now, as the coronavirus vaccines are more widely distributed slowly and surely, there's still some skepticism about COVID itself and, of course, vaccines. Some health workers and some residents have raised concerns about the safety of vaccines and their effectiveness. We continue talking about this hour, delving further with the University of KwaZulu-Natal Research and Innovation Vice Chancellor, Professor Mosa Mashabela, and also a colleague in the media, Robert Marawa, who recently found himself very ill. The long-time sports journalist was in the ICU after testing positive for COVID some weeks ago. His symptoms had escalated into pneumonia, and he's warning South Africans to take the virus more seriously. And he says he will get vaccinated when it's time. And I was hoping by now we'll be joined by Reverend Mishwe, but he's not available. But I still have with us Joost Strydom, who's the head of Orania Movement, and we had said goodbye to him a little bit earlier in case you were part of that conversation. Mr. Strydom, thank you for staying and welcome back. And if and when Reverend Kenneth Mishe does join us, we'll have to bid you goodbye and put him on. Prof, let me start with you scientifically. The good news in terms of the research that I was referring to earlier is that in that research, at least 71% of South African adults were willing to get the vaccine if it's available to them, and now we're seeing this is happening. But you must agree, even from a scientific perspective, that when you heard recently that there were questions with the J&J vaccine, and we have the Aspen pharmaceutical facility in Gqeberha, and now they had to do away or get rid of 2 million doses, you wonder, do they actually know what they are doing and they are putting into these vaccines, you know, and that they have to destroy so many. So it doesn't help the hesitancy, does it?
True, it does not help the hesitancy in the public. Fortunately for us in science, we tend to get a more detailed understanding of what is happening. So we don't necessarily have the same kind of misconceptions that the public might have. And this is also the information that then gets communicated to regulatory bodies and to governments as well. And I think for me, the issue then becomes how that insight and that information gets communicated to the public. But in the meantime, when the information is still waiting, in the process, other people are peddling other misinformation, other narratives that then make it difficult for people to accept whatever facts that may arise later. I have to say that, you know, South Africans, there's a lot to be optimistic about. You know, South Africans have always, in many ways, come through. We've learned a lot of lessons in the past from HIV, and we've changed. We've learned from information that changes constantly during that time. We are seeing that now, where information changes a lot. And so people have to keep up. And it's a challenge that we cannot ignore. But in terms of hesitancy, we've seen also that a lot more people, you know, since December, for example, are willing. You know, we started off with about 50% or so. We went to about 60%. Now it's 70%. That trend is a very positive trend. And we know that we don't need 100% of people to take vaccines. South Africa set a target of 67% in order to achieve herd immunity. If anything between 67%, 70%, and 80% people can take the vaccine, we will break the back of COVID-19 infections and their spread. So I would say, Dan, to you that, you know, I think it's quite optimistic to see it and encouraging to see the trend improve over time, but also to accept that there will be people who are not going to take it. And those people who don't take it will be protected by the ones who have taken the vaccine. That's how it works.
Yeah, so if you are willing and you're ready to take it, you must do so. I got my first Pfizer jab on the 1st of June, and my next one is set for the 13th of July. And I'm hoping that the Pfizer jabs will be in the country, as the government has announced, in their millions of doses, and that more people will get the jab. But Robert, when you hear the prof there, I don't know if you're able to hear the prof or not, he's talking about communication. You and I work in the media. We know how important it is to communicate. But sometimes on these social media platforms that are so fast and quick, there's a lot of fake stuff that circulates. I mean, how would you respond to that? Because you said when you were in hospital, you stopped reading, you listened to the practitioners. You got first-hand information from the practitioners.
Absolutely, Dan. I think in a similar way that the Prof is speaking to us now is exactly how I handled my situation, was to very little online, but mostly what I am learning, because I have educated professors as well around me in the science that we're currently dealing with. I had a team of doctors who are currently learning. I had a doctor who himself in December had also tested positive and was in the very same hospital. He had survived it, he had lived it, and he was able to talk me through it. That for me is the best way, is for people to access information. I mean, we've seen in America where there was Fauci saying one thing back when Trump was there, and Trump was saying something completely different, and there was a clash, but that was being politicized. So I would hope that in South Africa we have less of the politicization of a virus. We've already seen too much looting of something that was supposed to have been a pandemic. And people don't even feel ashamed about that. The fact that, you know, PPEs are not available at a time when the pandemic is at its worst, and especially in Gauteng. You know, we need to tell people that the longer you go without testing, the longer you go without actually finding out what is happening within your body, you're putting yourself at risk, you're putting your family at risk, you're putting everybody at risk, because by the time you realize what needs to be happening, you're going to need a ventilator, like I said, and that's not going to be available for you immediately, and especially if you are in Gauteng. So just take a step back. And you know, for me, the politicians, instead of grandstanding, I would love for them to get a chance to see how they can make testing something that is affordable. It is still 850 Rand. Yes, there's rapid tests that cost maybe 350, but it is an expensive exercise. People are watching the Euro on TV and they're saying, but here are packed stadia, how are they getting it right? And almost all of the people at that stadium, bar a couple, don't even wear masks, don't even have a sign of a mask even hanging under their chin. So for them, the virus is something that they've had to deal with. In South Africa, Dan, I just think that our communication around this, when they talk about there's going to be a family meeting, what is the main thing? What is the first thing South Africans talk about? What's the first thing that people worry about? It's about alcohol. So our communication, our issue, why is it around alcohol? Why is it a priority to talk about that? And already when they get reaction from other politicians about what the president has said, they also have somebody from the Alcohol Association to give their remark. We need to move away from that. We need to have people that are going to be responding, teaching, and telling people who might not know more about vaccination what that means. And we've gone through a point where last year, you know, it's about the taverns and the soldiers coming in and taking away alcohol. Why is it that we worry so much about the alcohol as opposed to getting the science across? You know, what the professor is saying to us right now is important information. What I'm hearing from Mr. Strydom on the other side, I mean, he talks about individual choice, but we also need to accommodate the fact that individual choice, yes, but when you're in a community of other people, you've got to drive the message that it is actually better to get the vaccine so that an entire community is then not affected, and they can still keep their numbers at an all-time low.
So we need to focus.
You know,
sorry, Robert.
The messaging needs to change.
The messaging needs to change. We need to focus on the right messaging, communicating the right things. Mr. Strydom, you said earlier in our discussion that among other advices you are giving to the Orania community is that they need to be proactive if they feel something. But are you also advising them about where to go for trustworthy information around COVID-19? Because online platforms are full of fake and misinformation.
Definitely. What we are doing is, even before the lockdowns in South Africa started, when we've only been hearing from the coronavirus from China and so on, we already established something that we call the Emergency Operational Center. In that Emergency Operational Center, there is medical doctors, there is some of our safety and security personnel, there is graduate communications personnel that's qualified in that area, there's people from the community, there's people from the municipality and so on. making of a task force that is focused solely on protecting and preserving the lives of the people of Orania. And that task force managed to not only broaden our medical equipment, our medical personnel, our medical facilities widely over the past year, we also managed to house by house deliver packages via the municipal services that we have, deliver packages with sanitizer, with locally produced masks, and so on and so on. And in that way, we have won over the trust of the community, so that they know they can come to us to get different views, but also come to us with trusted advice, and they know that the committee will do whatever is in their power to help preserve the lives of the people of Orania. It's to the utmost importance to us. With that, there's a lot of other things like the economy of the country, which has been massively affected by lockdown regulations. A lot of the lockdown regulations also have lowered the trust of the people towards the government. Some very, very absurd lockdown measures that we've seen regarding things like hot meals and summer clothes and so on, taking away trust from the government by the people of South Africa. And I think this also plays a role. The previous speaker said that the virus should not be politicized, but the government politicized this virus when they did things that seemed absurd, when there was so much money stolen that there's very, very little trust left for the ANC government by
I guess you're referring to the PPE corruption scandals that we've seen in parts of the country, yes. And people thinking, what is going on? In fact, recently I don't know if you gentlemen you are aware of the Edelman Trust Barometer. It's a global Edelman Trust Barometer that's showing that even globally, not just in South Africa, people are trusting more their companies that they work for. They're trusting more the CEOs, and they want their CEOs to speak up more and more about these issues, that there's more a lack of trust now in governments, public sector, and the media, Robert. They are trusting us less and less because of the proliferation of fake news, misinformation that sometimes we in the media get caught up in, and they're beginning to trust more their own organizations in their communities that they work for. Okay, we don't have much time left anymore for the conversation, but I want to give each of you gentlemen just a minute each as we wrap. Your parting thoughts. This is a very important discussion we're having today, especially when I listen to the Basic Minister of Education, Angie Motshekga, this morning in Limpopo, appealing to the trade unions in the education sector to encourage and convince their members who are teachers and stuff to get the jab, because some of them on religious grounds or others are very hesitant still today to take the jab. Now, Prof, you said you are optimistic because certain things are moving in the right direction. But as we conclude here, what will be your last message to anybody who's watching now who's still wondering whether or not they should get the jab?
So I've received a jab myself. I got the Johnson & Johnson in the last week of the Sisonke rollout as part of the frontline healthcare workers. People said that I will turn into a monkey, and I'm still not yet a monkey. Then I think that what's important is that it's really unfortunate then that our vaccination rollout at this point coincides with the third wave. And, it's really important that as we go out to register to get vaccines, that we do not forget the importance of protecting ourselves from infections. Yes, there's a lot that one needs to do once the infection has happened, and I think Robert has covered that pretty well. But I do think that we need to put a lot more effort in the circuit breaker efforts in terms of preventing the transmission of infection in the first place as much as possible, especially now, and especially in the provinces where they think that the cases are still low. We know that infections are spreading already in KwaZulu-Natal, in the Eastern Cape. It's important that we prioritize preventing those infections and not wait until we've been infected, because then it becomes much harder a battle in order to overcome that. That would be my appeal, while we still focus on making sure that people get vaccinated. If we can get past the third wave, we are going to get a lot more people vaccinated beyond the third wave. And those signs are clear and it looks promising. But really, it's about getting past this third wave.
Robert, your final thoughts very briefly.
Absolutely, Dan. I know you're out of time. For me, if you're feeling anything as you go into the weekend, I'll repeat again, any strange feeling, whether you're feeling hot and cold flashes, the hairs on your arm standing up, you know, when you almost get goosebumps, that's already a sign that there is a foreign body within you. Go get tested if you can, but please isolate if you're not able to get a test. But testing is priority as far as understanding what is going on in your system. Then you can take corrective action, get the oximeter, check your oxygen levels, and by all means, if you can stay at home, work from home, that'll save so many lives.
Thank you very much. Mr. Strydom, your final words as we conclude our discussion on vaccine hesitancy?
Yes, a bit of advice for the broader South Africans, especially for the South African government. I would say, if you want people's trust, do things that prove that they can trust you. In Orania, we've gone out of our way to protect our people, to keep them informed and to keep them safe and healthy. And that led to high levels of trust in a high-trust community. The South African government has done things during this lockdown that make people lose trust in them. They will have to win back the trust of the people of South Africa if they at all want to deserve that again. They need to take action and show that they are trustworthy.
Thank you very much. Joost, head of the Orania Movement. Robert Marawa, media colleague, sports journalist. And thank you very much, Prof. as well, Mashabela there from the KwaZulu-Natal University. And Professor Mashabela is acting Deputy Vice Chancellor and is also in charge of research and innovation at that institution. Thank you very much, gentlemen. Stay safe.